Hello, and welcome. Today we're diving into a complex neurological condition called Acute Disseminated Encephalomyelitis, or ADEM. This is a rare but serious disorder that affects the brain and spinal cord, leading to widespread inflammation and damage to myelin, the protective covering of nerve fibers. Join us as we explore the causes, symptoms, diagnosis, and treatment of ADEM. The exact cause of ADEM isn't fully understood, but it's often triggered by a recent viral or bacterial infection. Think of common childhood illnesses like measles, chickenpox, or even upper respiratory infections. In some cases, ADEM can also occur after vaccination. The immune system, in its attempt to fight off the infection or react to the vaccine, mistakenly attacks the myelin in the central nervous system. It's important to emphasize that vaccination is still overwhelmingly safe and effective, and ADEM following vaccination is exceedingly rare. Now let's talk about what happens at a cellular level. In ADEM, the immune system becomes overactive and targets myelin, the fatty substance that insulates nerve fibers. This process is called demyelination. When myelin is damaged, nerve signals can't transmit properly, leading to a variety of neurological symptoms. The inflammation and demyelination occur in multiple areas throughout the brain and spinal cord, which is why it's called disseminated encephalomyelitis. Encephalo refers to the brain, and myelitis refers to the spinal cord, highlighting that both are affected. ADEM is a relatively rare condition, predominantly affecting children and adolescents. While it can occur in adults, it's less common. Studies estimate that ADEM affects approximately 0.8 per 100,000 individuals annually. Because it's often linked to infections, there may be seasonal variations in its occurrence, with peaks following periods of increased viral illnesses. The symptoms of ADEM can vary widely depending on the areas of the brain and spinal cord that are affected. Common symptoms include sudden onset of neurological problems, such as weakness in the arms or legs, difficulty walking, loss of balance, vision problems like double vision or blurry vision, speech difficulties, and even seizures. Cognitive changes, such as confusion, irritability, and lethargy, are also frequently observed. In some cases, individuals may experience behavioral changes as well. Because the symptoms can evolve rapidly, early recognition is crucial. Diagnosing ADEM can be challenging, as its symptoms can resemble other neurological disorders. The diagnostic process typically involves a thorough neurological examination, including assessments of reflexes, muscle strength, coordination, and sensory function. Magnetic resonance imaging, or MRI, is the most important imaging tool, revealing characteristic patterns of inflammation, demyelination in the brain and spinal cord. A lumbar puncture, or spinal tap, may also be performed to analyze cerebrospinal fluid for signs of inflammation or infection. These findings, coupled with the patient's clinical history of a recent infection or vaccination, help clinicians arrive at a diagnosis of ADEM. While ADEM doesn't have distinct subtypes in the same way as some other neurological conditions, there are variations in the presentation and severity of the disease. Some cases are more severe than others, and the specific areas of the brain and spinal cord affected can differ from person to person. A similar condition called multiphasic disseminated encephalomyelitis (MDM) exists, where there are multiple episodes of ADEM. The primary goal of ADEM treatment is to reduce inflammation and prevent further damage to the nervous system. High-dose corticosteroids, administered intravenously, are often the first-line treatment to suppress the immune system. Intravenous immunoglobulin, or IV, which contains antibodies from healthy donors, is another therapeutic option that helps to modulate the immune response. In severe cases, plasma exchange, also known as plasmapheresis, may be used to remove harmful antibodies from the blood. Supportive care, including physical therapy, occupational therapy, and speech therapy, plays a vital role in helping individuals regain function and independence during recovery. Since ADEM is often triggered by infections, preventing infections through good hygiene practices, such as frequent hand washing, can potentially reduce the risk. While vaccinations are rarely associated with ADEM, maintaining up-to-date vaccinations is essential for preventing preventable diseases and protecting overall health. There's no specific way to guarantee prevention of ADEM, but minimizing exposure to infections and maintaining a healthy immune system are generally beneficial. The prognosis for ADEM is generally good, with most individuals making a significant recovery. However, the extent of recovery can vary depending on the severity of the initial episode and the timeliness of treatment. Some individuals may experience residual neurological deficits, such as weakness, vision problems, or cognitive difficulties, even after recovery. Research is ongoing to better understand the underlying mechanisms of ADEM and to develop more targeted therapies. Studies are investigating the role of specific immune cells and molecules in the disease process, with the hope of identifying new treatment targets. Advances in neuroimaging techniques are also improving our ability to diagnose and monitor ADEM, ultimately leading to better outcomes for patients.